During the current COVID-19 global pandemic, it is fundamental that we as patient advocates continue our activism and raise awareness for what is meaningful to us. And as a student, at times this has required us to be more creative and think of new and innovative ways to bring our members together. One of the most significant lessons that this year has taught us is that we can still have fun together and learn from one another. Even at a distance, let this be a reminder that if someone is important to you, you can still raise your voice and awareness for it.
COVID-19 has affected day-to-day life, businesses, disrupted the world trade and movement, and is slowing down the global economy. This virus appears to affect some communities, workplaces, and groups acutely than others. So, this pandemic has killed thousands of people who are either sick or being killed due to the spread of these diseases.
Hi, I'm Crystal Coliano, and I'm going to show you the symptoms of the coronavirus disease. So, keep watching. The symptoms of coronavirus disease. Most infected people will develop mild to moderate illness and recover without hospitalization. So, these are the symptoms. Most common are fever, dry cough, and also tiredness. So the less common symptoms are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin. So these three are the serious symptoms: difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. Seek immediate medical attention if you have serious symptoms, or always call the doctor before visiting the health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days.
According to WHO, the most common symptoms of COVID-19 are fever, tiredness, and dry cough. So, there are other serious symptoms like difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. So, people with mild symptoms who are otherwise healthy should manage their symptoms at home. Seek immediately medical attention if you have serious symptoms. Always call before visiting your doctor or health facilities.
COVID-19 affects in different ways. Most people will develop a mild or moderate illness and recover without hospitalization. Most common illness symptoms was have a fever, dry cough, and tiredness. Less common symptoms: aches and pain, sore throat, diarrhea, conjunctivitis, and headache, loss of taste or smell, rash on skin, or discoloration of fingers or toes. Serious symptoms was difficulty in breathing or short breathing, and loss of speech or movement. That's all. Thank you.
Hi, I am Giselle Requejo, and for this time, I will show you the list we can do to prevent the spread of COVID-19. As a student, what is the list we can do to prevent the spread of COVID-19? So, these are the list we can make to prevent the spread of COVID-19. Wear a mask in public indoor spaces in areas with widespread transmission of the COVID virus. Avoid close contact with people who are sick. Minimize touching your eyes, nose, and mouth. Stay home when you are sick. Wash your hands often with plain soap and water. Avoid crowds and practice social distancing. Wearing masks in public can help to slow the spread of virus. They can help keep people who may have the virus and do not know it from transmitting it to others by helping prevent respiratory droplets from traveling into the air and to other people when you cough, sneeze, or talk. So, this simple hygiene is the best way to prevent illness to avoid by being exposed to this virus. So, this is all we can do also for the sake for our family so that they do not get infected with any virus. It is still better to follow the advice of the majority so that we can avoid invisible diseases.
How to prevent the spread of COVID-19? As a student, we know that this COVID-19 virus is easy to spread people in several different ways. To protect ourselves, we have the helpful ways to prevent the spreading of COVID-19. First is wash your hands often with soap and water for at least 20 seconds, especially after being in a public place or after blowing your nose, coughing, or sneezing. And then, if soap and water are not readily available, use a hand sanitizer with at least 60% alcohol. Also, avoid touching your eyes, nose, or your mouth with unwashed hands. Avoid close contact with people who are sick. And cover your nose and mouth with a tissue with coughing or sneezing. If a tissue isn't available, cough or sneeze into your elbow or sleeve, not your hands. And clean and disinfectant frequently touch surface daily with a soft cloth and alcohol. Increase ventilation, open your windows, and let the sunlight in your house. Relax your body often by doing things that work for you. Take breath, stretch, and pray in activities you enjoy. Check to make sure you have at least a 30-day supply of your precaution medications and or have other health supplies on hand like vitamins or etc. And lastly, know your local public emergency COVID-19 hotlines.
Too many questions appear in our mind, thinking how this pandemic happened or started and why this pandemic exists until now. So, as we are expected, there were cause and effect of a certain phenomenon. And then, I will state what is the effect of coronavirus in the community or in the society. First, it has led to a dramatic loss of human life in our communities, societies, particularly in the emerging and developing world. Second, the pandemic has disseminated jobs and place of livelihood at risk. Without the means to earn an income during lockdown, many are unable to feed themselves and their families. For most, no income means no food, or at best, less food. And lastly, 1 year into pandemic, almost half of the world students are affected by school closures.